you very much. Good morning. My name's Richard Beasley, and I've got a wide involvement and interest in juvenile idiopathic arthritis. I'm married to an adult with JAA. Our daughter has JAA, and I'm the founder and director of Juvenile Arthritis Research. It's the only UK-wide charity and patient organisation that focuses solely on JAA. And I'm currently working towards a PhD on the epidemiology of aspects of JAA. To me, children and young people with JAA matter. Their families matter. Their experiences are important. And I'm passionate about making life better for them as far as possible. So here's my disclosures, and I'm happy if you take pictures if you wish to. But like Polly, I'm starting with a trigger warning. Today I'm talking about mental health in children and young people, and I'll be mentioning some serious impacts of that. If at any point you feel you need to leave, please feel free, I won't be offended. All the stories, the information and the impacts that I'm talking about are from real people that we support and people that we work with, and they've been used with permission, and we have anonymised them. As we've heard from Polly, there are some startling statistics, so thank you for highlighting them, about the mental health challenges for children and young people with JAA. We know that children and young people with chronic health conditions are more likely to experience negative mental health. Children with JAA experience worse mental health than their healthy peers. We know high proportions of children and young people need mental health support, but few have been offered that support during appointments, and we know that 4 out of every 5 parents felt that their child's diagnosis of JAA has impacted on their own mental health. 50% of patients with an autoimmune condition have depression-like symptoms, and poor physical health can cause significant stress and burden on a patient's mental health. In our patient organisation, we recently conducted a survey of adults with JAA, and over 73% of respondents told us that their mental health has been impacted by their arthritis, but less than half of them have been offered any support via their medical teams. The numbers are concerning, but behind every statistic sits a child or a young person, a real person, and it's their individual stories, the personal experiences of the real people that are most important. You see, children and young people with JAA are people first. Young people who are facing the normal challenges of growing up. Questions about identity and self-worth, stress about friendships, worries about exams and schools and family, anxiety about growing up and changing, with the added pressure of growing up in an increasingly stressful society, all the pressure that social media brings. It's a form of connected isolation. It's hard being a young person today. It's even harder if you have JAA. Because with JAA, you have the added stress, anxiety, and worry about your physical health on top of normal everyday growing up. Pain, discomfort, stiffness, reduced mobility, fatigue, plus medications and their side effects, and missing out on life because of your condition, because of your medication and appointments. Friends not understanding what life is like for you. Schools not making adjustments to help you to be able to fit in and access learning. Being different at that age when fitting in with your peers is really important. But do support services recognise this duality, the two separate but related parts of a young person's life? Our experience is sadly, no, they don't. Many services for young people focus on the normal and everyday world, but have no understanding of the additional struggles associated with JAA or other long-term health conditions, so the support they provide is limited at best. Others focus on the treatment-based issues. They're experts in that, but they ignore how that impacts a child's friendship, social life, and school. What follows is a real story. I've anonymised it. I've included the experiences of different families to create this single story so that you can't identify anybody, but this is what families that we represent and support experience. I've got consent from the families involved to represent this to you. The images are stock images, so this is not someone that we represent. Kay is 10 years old. They've had symptoms of juvenile idiopathic arthritis from the age of 2, but it took another 2 years before they were diagnosed, following multiple tests, appointments, and referrals. Their treatment started with joint injections. As we heard earlier, there's lots of needles involved in rheumatology, and methotrexate. But this was not effective, so they moved to biologics. Throughout their journey, Kay has had regular blood tests, multiple x-rays, multiple MRI appointments, injections, infusions, assessments under anaesthetic, and dozens of appointments with their rheumatologists, physiotherapists, podiatrists, ophthalmologists, nurses, and other members of the multidisciplinary team. Kay hated being in pain. They hated that their whole life was dictated by medication and hospital appointments. They were fed up of being nagged to do their physiotherapy. They were made to feel guilty at their routine appointments for not keeping up with their exercises. They felt their healthcare team didn't understand everything that they went through. Over time, Kay started to become increasingly worried about their injections. As their pain in their JAA reduced, the pain that they experienced because of their injection felt worse. If your knee no longer hurts from the inflammation, the injection feels a lot harder. Kay also worried about school. They were different to their friends. They didn't know how to share about their condition. They couldn't join in everything that they wanted to. Teachers just didn't understand that their condition varied day by day. Sometimes they'd be accused of faking it, faking being in pain to get out of PE. And their PE teacher would insist they took part despite their pain. At weekends, Kay wasn't able to visit their friends as often as they'd like to because they'd felt sick from their medication. Kay's parents worried about the future. What did a life with JAA mean for her as they grew up and prepared to move to secondary school? What impact would JAA have on them at college, at university, in work? Would they be able to have a family themselves? Would there be an impact on future fertility? Will they ever be able to stop their medications? Kay wanted to be a doctor, but they feel that's no longer an option because of their pain and reduced mobility. Due to their worries about injections, Kay was referred to a support team within their hospital. With support from a psychologist and play therapist, their anxiety about injections reduced. So Kay was discharged from their care. But Kay's non-clinical worries about school and about friendship hadn't been addressed. They still worried about being different. Kay's parents tried to contact the hospital about it, but nobody phoned back. The emails didn't get answered. The injection anxiety returned after a year. Kay's younger sibling has started to become worried too. They're known at school as the sibling of Kay, the one who's different. They don't have a health condition themselves, but their own life has been overshadowed by the appointments, the medication, and the problems that Kay experiences. As Kay started to become more anxious, their parents became more concerned. They spoke to their GP. They referred to the local CAMS team, the Child and Adolescent Mental Health Services. At their next appointment at the hospital, they asked for a referral back to psychology. Sadly, both had long waiting lists. And despite waiting for over 2 years, Kay has not yet been offered an appointment. Kay and their parents have asked for a wheelchair to help on their bad days, but have been told it isn't available to them as their clinical team want children with JA to be mobile without the use of aids as much as possible. But that means that on bad days, Kay is effectively housebound. They can't leave the house to go to school because they can't get there. Things recently became increasingly difficult. Kay's parents realised that Kay had started to self-harm and has shared that they're having spiralling negative thoughts. they've been talking about taking their own life. Kay didn't want to talk to their rheumatologist about this. The rheumatologist is always busy. There's long waits in clinic and they don't want to add to them. Kay's family didn't want to add to the pressure on the hospital team. They didn't know who to turn to or where to get extra support from. They became anxious and worried themselves, concerned that Kay was now self-harming, unsure of how to address it. Kay was becoming increasingly withdrawn, and the few friendships they had started to wane. They became tearful and angry, but they were unable to explain how they felt or why they were reacting in the way that they did. They tried to avoid school, giving reasons for not wanting to be there and sitting out of lessons. Overall, Kay's mental health was starting to spiral downwards, affecting every aspect of their life and everyone in their family. Kay's parents were ashamed. They didn't want to tell people how Kay was feeling. Mental health still carries a huge stigma. They were worried about being judged by others, but they did realise that they needed help. They've previously received support from our patient organisation, Juvenile Arthritis Research, and they remembered that we provide information and support. They weren't sure if mental health was something that we could help with, but in an act of desperation, and they really are the words they used, they contacted us, asking for ideas. Who could they turn to? Where could they get some help? They needed fast treatment, fast access to specialist mental health support, but they didn't have the resources to fund urgent private therapy sessions. And as you've heard, the wait on the public accessible services were years long. We immediately funded a course of therapy sessions for Kay. The therapist has recognised that the years of JAA-related trauma, injections, medications, treatment, being held down for blood tests, and the years of being different and being treated differently by other people have taken their toll. They're now working with Kay and their parents to support them. They've been referred to the Teapot, Kay's siblings have been referred to the Teapot Trust, that's an art therapy service that was mentioned earlier, to give them support. Kay's parents have been given access to other national family support charities. As a patient organisation, we've provided them with additional tools and resources. Some of those you'd have heard about over the last few days, including our I Have JAA cards. Kay's been able to take those into school to explain their condition to their friends. It's hard to start to take away some of the stigma just of being different. We've provided a school toolkit and school's fact sheet for Kay's school to help them understand what Kay's going through and how they can support. Kay is making a recovery, and with support already provided to them and their family, we are hopeful for them and their future. But it's going to be a long and slow and difficult journey for them. So we can see that children and young people with JAA experience mental health challenges. We've heard that their families do too. But what support is there for them? In the UK, there's a wide range of services available to support people with their mental health. You've heard some of the challenges earlier from one of the questions that was raised. The problem is that some of them are aimed only at adults. Some offer only self-directed low-level support. Some don't provide help to those with chronic conditions. Some won't provide any support if you have severe needs, even if their service could help you with your initial concerns. If you mention suicidal ideation, you're cut from their service, even though they could offer some other support. Some offer only emergency crisis support with no follow-up or long-term provision. Some have very long delays. And others, when you reach the front of the queue, remove you from their service immediately due to backlogs and a lack of provision. Many children and young people with JAA have other comorbidities such as autism, ADHD or other physical health needs, and some mental health services don't provide support to them, which leaves very few services. Hospital-based psychology, as we've heard, is a promising option, but it's not available in many centres, has restricted availability, and focuses on the JAA-specific concerns and not necessarily the wider needs of the child. And support for parents is even more limited. So the options and support are very limited. But what's actually available? How can we support children and young people with JAA and their families? In some countries, there are good mental health support services already in place. I'm part of the ENCA board, and through that I was able to contact a number of patient organisations to ask for their input. What does good look like in your country? And we've been told that in parts of the Netherlands, there are generally good psychology support services within both rheumatology and the wider community. And having access to mental health professionals who understand your condition and how it impacts your life is really, really important. And a good integrated team addressing your needs as a patient and a family is ideal. A number of organisations, I'm going to do a whistle-stop tour of some of the services available that we've been shared with us. But a number of organisations have both live and pre-recorded webinars that you can watch on demand. For example, Cassie and Friends in Canada host webinars about a range of topics, including the impact of rheumatic diseases on mental health. And they invite young people, parents, patients, and experts to share their experiences and tips for helping maintain good mental health. The fantastic thing about the Cassie and Friends webinars is that if you're in Europe, they're about 2 o'clock in the morning, but they do record them all and you can watch them all afterwards on demand. We know that for some children, it's the medication or the route of administration of their medication that causes or contributes to their anxiety. So helping children and young people overcome worries about injections can make a big difference. On our own website, we have webinars with suggestions and tips from a child psychotherapist. Practical tips and ideas to help reduce stress, reduce anxiety, and suggestions for parents to help better support their children with JAA-related worries. Many patient organisations refer to other more specialist providers. Arthritis Kids South Africa signpost families to the Comfort Ability website and their books, and they aim to help young people with chronic pain. Cassie and Friends refer to a range of services both for young people and their caregivers, and Juvenile Arthritis Research signpost to emergency support services as well as to other providers. We've already mentioned the Teapot Trust and their art therapy services. For parents, Cassie and Friends provide information and resources online and point towards other providers. Their webinar about putting on your own life jacket highlights the importance of protecting and strengthening your own mental health as a caregiver so you're better able to support your child. And often that's something that, as parents ourselves, is so easily overlooked. In the UK, Contact provides support to parents of children with rare conditions such as JAA, and the Teapot Trust offers support through art therapy to children with JAA and their siblings. Some clinics have really good integrated mental health support in transition clinics, and Gabby's going to be talking about that shortly. Supporting young people through the challenges they experience as they are transferred from paediatric to adolescent to adult services in healthcare is so important, as that's another area of change. And a change, nobody likes that, and uncertainty can be a cause of anxiety. For young adults with rheumatic conditions, the WREN project in the UK offer a listening service. It's a safe place to speak with others who understand what you're going through, and that helps reduce anxiety and stress and isolation. A number of services exist providing crisis and emergency support. For example, in the UK, there are the Samaritans, Young Minds, and Papyrus, and many others. But these are not long-term solutions. They're not specific to children and young people with rheumatic conditions, and whilst they are expert in providing emergency support, they're less familiar with the issues related to chronic conditions such as JAA. They provide support through phone lines, online chat, live online support, text messages. There's a whole range of ways of accessing them when you need help in a crisis. There are a few organisations that have developed integrated information hubs. Both Cassie and Friends and Juvenile Arthritis Research have hubs on their website. The great thing about things on websites is you can access them wherever you are in the world. These are places where both low-level support, online resources, signposting and additional tools are available for people who need that support. One of the other great things about a website is nobody knows you've been there. So if you're a young person or a parent who's struggling, needs a bit of extra support, you don't have to make a phone call, you don't have to tell anyone. It's a place where you can start to access that support anonymously. One key is to nip issues in the bud, to help prevent things from getting worse. Distraction techniques can help with that. There's been other examples of that earlier in the week from other speakers as well. Techniques, activities, and practical tips. Hearing from other parents helps. Someone who's been through the same thing as you. Knowing that you're not alone and knowing there's a network of other parents who have been through the same sort of issues before helps take some of that stigma away. Integrated hubs help with that, and they make it clear that supporting your mental health is a key part of living with JAA. As we heard in the case study that I read, sometimes personal one-to-one support is needed, but it isn't always available. We provide directly funded one-to-one support through appropriate professionals, but that takes resource and it takes funding, and we can't do nearly enough. There are many, many more who need access to that support. So what have we learned so far? It's hard being a young person. It's harder if you have a chronic health condition like JAA. And what could be a small issue can quickly escalate if it isn't dealt with properly and effectively and quickly. A child who gets worried before their injections, who's anxious about the nausea that follows, or who feels left out at school can easily become isolated and depressed. Mental health issues become all-encompassing, and the darkness takes over your whole life, not just the few minutes before that injection. That's why sorting it out early is so important, and why access to appropriate support is vital. So what next? Even with these support services that I've spoken about in place, and even though we can all learn from each other, it simply isn't enough. We've heard from children and young people who tell us that they cannot carry on. They can no longer cope, that they want to end it all. And there's no support for them. There's no way for them to access the support services. There's nobody out there who can step in, who can reach out to them and keep them safe. As patient organisations, as parents, as researchers, as clinicians, as healthcare professionals, we will all have failed if we don't put something in place to make life possible for our young people. Here's some specific things that I think we need to do. And we need to do them together. We need mental health support integrated into normal everyday care. Mental health support, psychological support, is not a separate issue. It's not someone else's problem to deal with. We were asked earlier, how can someone raise the questions? And actually, I'd say that at every appointment, whether it's with a doctor, a nurse, a physiotherapist, an OT, phlebotomist, receptionist, anyone else, ask how that young person is doing. Make it normal to talk. Listen to them. Clinics need to ensure there's support for every patient, and teams need to know how to access that for a young person who needs it. As Polly says, when someone said they need help, you need a way of getting that help to them quickly. We need to improve understanding of mental health challenges for children and young people with JAA, the challenges they're facing and what we can do to help them. We need increased awareness that children and young people and their families may struggle. There's no shame and there's no stigma in it. And we need to improve signposting to that lower level specific support that's available through websites such as ours, Cassie and Friends and others. We need improved access to higher levels of mental health support without long delays, without access issues, because we need it to be available for every child and young person who needs it. Best case, everyone with JAA and every family member should have access to the support that they need when they need it in a way that works for them. Overall, we need to increase awareness of JAA and other childhood rheumatic conditions as well, because increased awareness reduces the delays in diagnosis and helps improve outcomes. It reduces the stigma. You're no longer alone. And it helps children and young people feel less isolated whilst they have better physical health, and that leads to better mental health. Let me close with a challenge for you. If we do nothing, if we don't make life possible for children and young people facing a mental health crisis because of their rheumatic condition, if we don't make real, tangible, positive difference, then we will have failed. So if you want to make a difference, if you want to build a better experience for children and young people with JA, not by sitting down and just talking about it, not by stroking our own egos or adding something to our CV, but actually doing something, then get in touch with me. My details are on the screen. We need resources, we need funding, but we also need ideas from different people, from different backgrounds, different experiences. People who are passionate about making a difference. Organisations who aren't afraid of making changes to benefit the lives of children and young people and their families. Because together we can make a difference, and we can fill the gaps in mental health provision. Yes, there are costs associated with putting things in place, but the costs of doing nothing are much, much greater. Thank you.
Many thanks, Richard, for that thought-provoking talk. It certainly made me think about things a lot. I wondered if we had any questions, please.
Thank you, Richard, for a wonderful talk. Few remarks. First of all, you see Lucy is here. Lucy is one of the leading scientists in basic research. So she's sitting in this room because she thinks how mental health is important as a biomarker. Also, Suza is leading an international study, and one of the parts is mental health. So I just want to be realistic, because in most of the places we will not have enough psychologists. So we have to do things in different ways. So different ways is by families and by friends. So parents are supported to other parents. So many times if I face parents of a new child diagnosed with GIA and I see they are getting lost, I give them a telephone, or sometimes ask the other parents to phone them. Or same with the young kids or more adolescent. Do you need hand? Do you want another one that passed it a year ago to talk with you? The problem is most of them don't. Even we suggest them. It takes few meetings to convince them that it will make them good. And once they find another friend, it's helpful for them. So this is not by professional psychology. We need the professional team for the more severe cases. Other thing that we do, we have teachers in the inpatient department. Teacher, art therapist, musical therapist, and we ask them, for some of our patients, to come to the ambulatory day unit and to be with them. So this is another kind of support which doesn't cost, because we don't have the resources for real professional, full-time psychologists or whatever. So, thanks.
Thank you. Yeah, I agree that we don't necessarily want full-time professional psychologists for every child. Not every child will need that. And you're right, putting families in touch with each other makes a huge difference. We've developed an informal network of young people. They're supported by parents, but they're on a WhatsApp group, and they chat and they talk about anything except their JA, but they all know they've got JA, so they can bounce ideas off each other, and that having that network of people builds that support. But long-term, overall, there are still those children who need that psychology support, that professional specialist service. At the moment, there are so many who just can't access it, certainly in the UK, because the services are overwhelmed and not resourced enough. And we're not the people who can resource them. We don't have the funds that government needs to put into it. But yeah, we need to make sure that there are the right level of support for the right children at the right time.
Thank you, Richard. Yeah, it's the same in the Netherlands with limited support, especially after COVID. And our daughter had psychology, a psychologist and therapy over the years, different kinds of stages, because if you're young, you need a different kind of support. Now she's 17, and we finally got her in. And the result was they said, no, you don't have ADHD or a depression. Well, all the signs were there, because it could be caused, the therapist said, because of your medication, or because you have the disease. So because of that, and I objected, I said, so she can only be depressed if she doesn't have a disease. And she said, well, basically, yeah. So she didn't get a diagnosis, and she didn't get the help. And that was a professional team. So you still have psychologists out there, and now I'm like, oh, I'm reminded of a project, and I saw in a research paper, I'm like, I have to send this to them, because, so still if you get in after, 2-3 years wait, the psychologist said, yeah, no, you don't qualify, because it could be caused by the medication or your disease itself. It doesn't take the problem away. Yeah. But even if you get through,
I'm really sorry to hear that that's been your experience, and sadly that's the experience that we've had too. That when you're waiting for a long time and you get there and you don't tick the right box, so you're off again.
Yeah. So my daughter is like, okay, door closed, forget it. So it's really frustrating. So you finally have a team that is willing and kind of open the door, ever so slightly, for help, saying, okay. She literally said, I'm lost in the woods. I can't find the path out. And it was the first time she actually, also had the words to express how she felt. And they closed the door on her. I mean, I don't know what you need to do after that. So there is so much and it helps. I see that if we have our weekends with the Dutch Juvenile Arthritis Association, it's not necessarily that they talk to each other, but they can see, oh, I'm not the only one tired after the morning thing. And those kind of things help. But sometimes you need either medication or the right kind of therapy to get you through the next level, really. But it's hard. I've been in the game 20 years, also as someone with autism and ADHD. I'm a researcher partly as well. Still don't know the answer. And I know that a lot of doctors are working on it, but there are also still doctors that, we all struggle. You just have to accept your disease. And it's hard. I don't know.
Thank you.
Thank you. I think we just have a comment from the table.
Oh, thank you very much. My name is David Gosar. I'm a clinical psychologist. I come from Ljubljana, Slovenia. I work at the University Medical Center there at the pediatric hospital. And I have to admit, these talks have been making me really angry. And they've been making me really angry because suicide is the second or third leading cause of death in children from 14 to 20, or young people from 14 to 29. So this is the second leading cause of death, and you're not screening for it. It's ridiculous. You have scales for measuring, you have an intention to treat, to target, you're checking, you're giving out scales for physical exercise, you're giving out scales for pain, and you're not screening for depression and suicide. Are you crazy? It's ridiculous. And saying you don't have the resources is complete nonsense. You have time for those 5 questions. And in terms of who can handle it, you have to realize that we as clinical psychologists were far too few to handle mental health issues. About 30% of people even seek help for their mental health issues, and even those, we can't treat all of those. So the thing is education. So how is it possible that nurses and rheumatologists have no education on mental health? That has to be a basic part. It's the second leading cause. That's just the suicide. So I think that you have to do a lot more, far more. And just pushing it to someone else, it doesn't work. I'm sorry. I mean, if you're treating a child who is obviously depressed, you give. The other thing was said, they don't ask and they don't want to tell. That's not true. And you know why not? Because the majority of people who report on self-harm, suicidal behavior, they report on questionnaires. It's easier to tick down a box than it is to say it to someone's face. So I think it doesn't take much to improve standards here. The other thing is, I just want to really thank you for your inspiring talk. It was really moving. And I hope you use all your political force to move also the policymakers. I mean, investment in mental health needs to increase severely because the mental health issues in young people have increased severely. So I really appreciate your efforts. Thank you.